medical devices are really interesting because you've got the whole world of traditional devices, whether they're orthopedics or whether they're diagnostic devices, or in-hospital medical devices that are getting reinvented in the advent of cloud services, patient privacy, and the decoupling of and the hollowing out of the hospital, and the fact that hospitals are now becoming just really for the sickest of the sick patients, and everything that can be done outside of a hospital should be done outside of a hospital. And so that's the rise of retail medicine. That's the rise of consumer medicine, where you're doing a lot of things at home. And the key is to maintain the high quality, but while increasing the access and quality of these diagnoses and treatments and monitoring. And so everyone's trying to do this and looking at the ways to do it, whether it's the hospital systems, the pharmaceutical companies, the insurers, and really eventually the payers, being the government and the big self-insured employers in America, at the population scale. But technology is really one of the few things that helps accomplish that triple aim. And that's what we're convening in our health policy sessions for the Hacking Medicine Institute. The fantastic thing about MIT is that it's not just about strong academic science and clinical science, but it's really about translating that to the real world, applied engineering. That's why I love it here. That's why I came here from Harvard Medical School. And the wonderful thing about MIT is that we have an incredible flow of the best companies and industrial partners in the world. And in fact, if you just look around in Kendall Square, you see the biggest pharmaceutical companies, Novartis and Pfizer and Biogen, and GSK and AstraZeneca are all located here. Then you have the biggest tech companies. You've got Google, you've got Microsoft, just here a stone's throw away. And you've got all of these hundreds of MIT originated, many of them, digital health and medical diagnostic companies that are here. And so it's an incredible ecosystem to bring ideas and start to generate data with academic partners that lend to the clinical credibility. And that's why Philips and IBM have recently moved their research headquarters for healthcare here to Kendall Square and are joining the ecosystem. And it's really powerful. And so one of the best ways to tap into that ecosystem is actually move bodies of the company to this area and start to interact with it. They can do that at our open events, the Hacking Medicine events. Every April we have the Grand Hack for Hacking Medicine Institute, and that is on the top floor of the MIT Media Lab, and we have over 500 people on a weekend bringing together solutions, proposing, testing, and validating whether those are really translatable to the real world.